Hello, my name's Brad Jones. I'm a physician assistant, and I've been here going on 13 years in June. So I'm going to be discussing an article by the World Health Organization, also known as WHO. Its first ever guidelines published in 2023 on managing chronic primary low back pain. They provided a list of interventions for us as clinicians to utilize when establishing a treatment plan. A 25-member guideline development group of clinical experts and 14-member external review group, which was a mix of clinical disciplines, brought forth these guidelines. Definition: chronic primary low back pain, which is persistent or recurrent pain experience of greater than 3 months that is not reliably attributed to another underlying disease process, such as an inflammatory autoimmune condition, malignancy, infection, structural lesion like fracture or deformity. Low back pain is a very common condition experienced by most people across their lifetime. Low back pain is the leading cause of disability nationwide in all age groups and both genders. Prevalence and disability rates are greatest in older people. Low back pain is a condition which represents the greatest number of people for whom benefits may be experienced. The prevalence, health burden, and economic costs associated with low back pain care continue to rise. Most people who experience an episode of acute low back pain have low to moderate levels of disability and favorable clinical course. Often episodes of low back pain become more frequent in older age. The experience of low back pain can cause loss of physical and mental capacities. For many older individuals, low back pain can restrict mobility, impacting participation in society, and can lead to psychosocial issues. Higher mortality is strongly related to a decrease in health-related quality of life. Here we would tailor a package of interventions. Adults with chronic primary low back pain may require a number of interventions to experience benefit rather than a single intervention alone. The selection and sequencing of interventions should address the range of factors that contribute to that person's low back pain experience. Generally, we would start with the least invasive and least potentially harmful intervention. WHO provides recommendations for a range of non-surgical interventions that are offered as part of care for adults with chronic primary low back pain, as well as interventions that should not be offered as part of the routine care. These interventions are discussed below. We start with non-surgical interventions that should be offered to patients with low back pain, and these include, by WHO, structured exercise therapies or programs, which are a series of specific movements with the aim of training or developing muscle, joint strength and function, range of motion, and aerobic capacity. Also, there's myofascial trigger points, needling, and acupuncture. We have spinal manipulative therapy, which should be done by a trained provider. Massage, which is manipulation of soft body tissues by a trained provider. And mobility assistive products such as wheelchairs, mobility scooters, crutches, canes, and walkers. The next type of interventions would be educational or psychological. We do offer educational psychological interventions done here by our psychologists, which include operant therapy with aims to replace pain-related behaviors with healthy behaviors like exercise and work. There's also cognitive behavioral therapy, which is based on a multidimensional model of pain and focuses on reducing pain and distress by modifying physical sensation, catastrophic thinking, and unhealthful behavior. Next type of intervention would be medications, which is number 1, medication should be initially prescribed in tablet form. Number 2, pain medication should be used in regular intervals. Number 3, medication should be prescribed according to pain intensity, characterized by you, the patient. Number 4, we would start at lowest dose and duration possible and titrate up according to how patients respond. Number 5 is consistent administration of analgesic is vital for effective pain management. So then we go to step 1, which would be the NSAIDs and non-opioid medications. Step 2, which would be your weak opioids like codeine or tramadol. Step 3, which are stronger opioids like hydrocodone, oxycodone, and morphine. These other interventions here are not recommended by WHO, which include TENS units, traction of the lumbar spine or cervical spine, therapeutic ultrasound, and lumbar brace and supports. And these here are medications that are not recommended initially by WHO, which include duloxetine, weight loss medications like Ozempic and phentermine, tricyclic antidepressants like amitriptyline, skeletal muscle relaxers, anticonvulsants like gabapentin and pregabalin, injectable local anesthetics, and glucocorticoids. And last, they did not study cannabis-related pharmaceutical preparations, which has become very common in the past several months. We do a lot of these interventions here at Michigan Neurology and Pain Consultants. Thank you.